interesting thing too, Jarrett, is like, okay, this is maybe not kosher to say, but sometimes it is you. Like sometimes it is the person and sometimes it is their partner, you know? And we always say it's not you, but like, okay, I saw a guy earlier this week. He's 21 years old. Okay.
Mm-hmm.
He's coming in because he has concerns about erectile function. And his concern is that he has to stimulate his penis with his hand in order to get an erection that is sufficient for intercourse with his partner. To me, that doesn't sound abnormal, right? That sounds like, yeah, you have to be stimulated to get an erection. For him, it seems abnormal. And when we got further into this conversation, he said, my girlfriend doesn't think she's good at it. So my girlfriend doesn't really touch me during foreplay. Well, no wonder he needs to then touch himself.
Yeah.
You know, so like in that case, I think the biggest thing that's going to help him, I mean, yeah, some Cialis is going to help. I love a good Cialis. I'll pretty much put anyone on that medication. But his partner needs to learn how to stimulate him. His partner needs to know what feels good. And I said, you just have to tell your partner how to touch you.
Yeah, you're getting more into the mental aspects of what can happen when you have that disconnect, right? So you're 100% true. Yeah, sometimes it is the partner, and I would even say sometimes it's the partner in a negative way, right?
Yeah.
If the partner starts to really blame you, and depending on how long that period goes before you seek help, well, now you beat yourself up for months, years, and it could become a mess. So you're right. Sometimes it is the partner.
Well, and you know, I see men and women, and what I hear, although the guys aren't verbalizing this, but when I verbalize it, they tell me I'm like spot on, is the guys feel like they're always initiating, and it becomes, you know, oftentimes, I mean, libidos in both men and women can go down, and especially women as they go through perimenopause and menopause, it's very common for libidos to go down. And so the guys just feel like their partners are just doing it to do it, but they're not really enjoying it.
Yeah.
And that has a huge impact on someone's ability to get and maintain an erection and reach climax. If they feel like their partner is just trying to check the box to get it over with, that will absolutely impact his function. And so why I try to medicalize it and say, look, it's not you, it's not your partner, it's the diabetes, it's the high blood pressure. This is super common. I think we also have to acknowledge that the relationship and the partner and how much the partner wants to do it absolutely has an impact.
Absolutely. Yeah.
And that is important because then we can actually address this as a multidisciplinary and a multi-pronged approach. But no one, even if I put someone on high dose Cialis, if they know deep down their partner doesn't want to have sex, it's going to be hard to enjoy that experience.
Yeah. There's nuances to that even further, speaking from a guy's point of view, right? You could have, you may have a partner that not just only wants you to initiate it, but wants you to initiate it a certain way, which that way can change, right? On a whim. And so you're behind the eight ball on that stance as well. So very, 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 very good points. It's a very deep issue.
Yeah. Well, and the way that we communicate and the way that we verbalize our sexual scripts, they have to be just as dynamic as we are as people. Let me give you an example. Maybe in our 20s, the script from going to a non-sexual environment to one where, two people are in bed and having sex was, hey, babe, do you want a glass of wine? And then both people kind of knew without saying it where this was going. But then let's say a couple's in their 40s. That sexual script has to change because maybe, the kids are out of the house now for 30 minutes. They got 30 minutes. They don't have time to drink a glass of wine. But maybe that script is now, hey, babe, do you want a massage? Like a quick massage. You want me to rub your foot, right?
Right.
And then, but once Viagra enters or Cialis enters or someone, let's say, is doing penile injections or using a vacuum pump, maybe the script is, hey, babe, can I grab you some Viagra?
There you
Cheers,
go.
that kind of sounds sexy, right? A little
Yeah,
bit.
that was actually pretty good. I'm
Hey babe,
hot
why
here.
don't you put a ring on it, like an erection ring? Hey
Yeah.
babe, can I pump you up? You know, or hey babe, let me grab that vibrator. Or hey babe, you look so sexy using that vibrator last night. I was wondering if I could go grab that for you. So we use these tools in a way that's, again, not coming from a place of deficiency, of saying you or your body are not enough, but babe, I love you. I love what we have together. And I want to make this as good as possible for both of us. So let's get creative.
Yep.
But we have to be thoughtful about how those scripts will change as we change as people.
We really do. And we have to, there's some acceptance that has to happen between the both parties that I'm accepting that introduction of all the tools you just mentioned is part of who we are now, right? It brings us, it should bring us together, not say, well, you're only doing that because blah, 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 blah. Yeah, it should be bringing us together. So excellent point. Is there a tool or to call it a tool that you prefer or that is new on the market that you're like, okay, this can really enhance some of these situations and some people's issues better than others at the moment?
Oh, there are so many, Jarrett. How much time do you have?
I'm
like, I feel like
you're the one that has to see patience. I'm just an owner. I don't do anything
I can
around
feel
here.
like a Home Depot, like full of stuff, right?
Okay,
And that's where the challenge is.
Give me your top 4.
Okay, top 4. Okay, well, let me go through my office and let me pick the top 4 that are going to address different things here. All right, let's start with erections.
I'm eager to learn. Yes.
Okay, sounds good. Because, so I used to be in academics. Now I'm in private practice. And I'm an early adopter of new technology. I love technology. Technology in the sexual space, sex tech as we call it, is a multi-billion-dollar industry. And I want to be on the forefront of it because people want to know about it. That's what gets people excited, right? It's a growing market. It's an opportunity for people like you and I, right, who have our own practices to stand out from other practices. It's a way that we can take someone from having good sex to great sex, even though they don't have any dysfunction. And it's a way that we can stay relevant in the field. And I look at that from my perspective, coming from academics, where I used to have a big research team of a lot of medical students and residents. And now I'm in a private practice. So how do I stay relevant within my group of colleagues? Well, I have to continue to contribute something to my field. And where I found a way to stay relevant is if I know more about sex tech than a lot of my colleagues. And when I'm standing in front of a room and I have an audience, I legitimately feel like I can teach my colleagues something.
Wow.
And so that's where I really like this innovation because it's constantly evolving. Medicine in general doesn't evolve that quickly. Even in the sexual medicine space, we're using the same medications we were using 25 years ago, right? But in the technology space in sexual medicine, that is evolving way more quickly than pharmacologic agents. So let me grab some items for you.
I have my pen. I'm ready.
Okay. Now, the products that I'm going to show, some of them I'm on advisory boards for these companies. So I do want to disclose that information. I like to be involved in as many companies as possible because then I get the inside scoop on how these technologies evolve. And I like knowing more information about these technologies in a way that I can better explain them to my patients as well. Okay, so this is one technology. This is the Tech Ring by FirmTech. One second. And I can send you these links too, so you can post them if you're interested. Okay, so when a guy comes in, to a clinic like yours or a clinic like mine, oftentimes we're trying to assess his erectile function. So we might ask questions like, are you getting, morning erections? Are you getting nighttime erections? Are you getting the erections you want when you're with your partner? But oftentimes people don't know if they're getting nighttime erections. if they're sleeping through the night and they sleep like babies, right?
Yeah.
And because I'm not going home with my patients, right? I don't know what's happening with their nighttime erections. So if they're not functioning with their partner, how do I assess whether their plumbing is working?
Gotcha.
It's the same thing if someone wanted to track their sleep or their step count. You don't count how many steps you're walking in a day. You get a device to help you. So we actually now have a device that will monitor erectile fitness. And notice how I said fitness and not dysfunction, because anyone who wants data related to their erectile fitness would benefit from a wearable, just like you don't need to have a sleep problem to benefit from an Oura ring. You just have to be curious about your sleep quality. So what you would do with this ring is you would drop the testicles in here. It's designed to close like the back of a bra, so it's very easy to close. One part goes around the base of the scrotum, the other goes around the base of the penis. It has a pressure sensor right here and a strain gauge. So when this closes and the penis becomes erect, right, it creates some tension. That information gets uploaded into a formula, which then via Bluetooth will go to someone's smartphone. So the person could wear this all night long. It still allows blood in and out of the penis. And he could look at the graphs on his phone the next day in a way that shows him the number of erections he got, how long his erections lasted, and how firm he got. So if someone wanted to know, what?
That's impressive. That's impressive.
So if someone wanted to know, or someone asked me, Dr. Perlman, what is the impact of alcohol on erectile function? Well, I can tell them that alcohol, a little bit of alcohol, can be helpful for some people, helps people feel more relaxed. But too much alcohol, I mean, I don't need to say the entire term, but hashtag whiskey fill in the blank is real. I think we all know that, right? Can be detrimental. But what if that person wanted to know, well, how much alcohol is detrimental? I'll never be able to answer that question for my patient, but he can answer that question for himself. Yeah. So if he were to wear this ring on nights where, let's say, he drank 2 beers a night, and then he were to wear this ring when he were drinking 3 or 4 beers a night, he could track his erectile fitness and answer that question. Now, ultimately, I would say get off the alcohol altogether, because in general, alcohol has no redeeming qualities. Yeah. But people are looking for a personalized approach. I have some people that ask, what are the effects of gummies on erectile function? Because I've had some people say they're helpful and some people say they're not helpful. Yeah. Well, I would tell the person, you should answer that question, but you can't track what you don't measure, right? And what I find helpful in terms of tracking nighttime erections is it takes all the other stuff out of it that gets involved when you're with a partner. So it's really the best way for us to assess the plumbing is when you're sleeping, what's happening. The other way where it can be helpful is in guys who, let's say, had prostate cancer and had their prostate treated for that. It can take several months for the erections to improve to their new baseline. So I'm a big believer in penile rehabilitation with guys using things like vacuum pumps to help stretch out the tissue. But if a guy, let's say, is wearing a ring and notices, let's say at month 5, that now he's getting nighttime erections, that means he's exercising his penis. So if, let's say, he wanted to stop using a vacuum pump during the day, that might be an appropriate time where maybe it's not as important anymore because he is getting that stretch at night. But I like this for data. Data is king. People like information, and people can be their own experiment. Wow. It can also double as an erection ring. So a lot of people only think of erection rings in the setting of using it in combination with a vacuum pump. But what I see so often, what all of us see in our clinics, is a lot of guys can get the erection, but it's difficult to maintain the erection. So sure, you can use medications like Viagra or Cialis to try to shunt as much blood into the penis as possible to overcome those veins opening up too soon. But if that doesn't do the trick, then if you put a ring around the penis and it literally blocks or compresses the veins, you're going to keep the blood in the penis longer. Yeah. So I think erection rings are very underutilized. In men who have sex with men, I think they got the memo that you can use all of these toys just for pleasure and the experience and not have to have a problem. Yeah. And so my message is for the guys watching is everything that we're discussing right now, you might benefit from, and you don't have to have a problem.
Yeah, exactly.
Yeah. So this is a really cool device, a wearable device in the sex tech world. The company is going to be working on one to assess clitoral blood flow. So I think if we can see both and get some of that data, I think it's really going to be a game changer. Okay, the next device is going into like the penile enhancement space or penile lengthening. There are a lot of guys who are concerned about their penile size, or guys who might have penile curvature. They have their prostate removed for prostate cancer and may have noticed some shrinkage or length of loss of length, or guys who have something like diabetes or chronic conditions where they've noticed their penis is not as big as it used to be. And I have a lot of guys that come in that ask, are there any safe options? Or guys that say, oh, I didn't think there were any safe options, so I'm not even going to ask about it. There are safe options now for increasing the size of the penis, but there are a lot of different products out there, and you don't want to choose one that's just full of snake oil, right? Yeah. So this product was developed out of the Mayo Clinic by a colleague of mine, Landon Trost. He's a fellow urologist, and it's called the RestoreX device, and it's a traction device to lengthen the penis. So what the guy would do is he would put his flaccid penis through here. He would clamp down on the tip, and it's spring loaded to stretch the penis to put it on traction. If the guy has curvature, he can then bend the penis in the opposite direction.
Wow. And
this device, unlike a lot of the other traction devices out there where the protocols are to wear it for 6 or 8 hours a day, which who has time for that? This device has shown benefit using it in as little as like 30 minutes a day. So for any of my patients who are interested in penile lengthening, if they use this device for like 30 minutes a day, 5 or more days a week for 3 months, they might notice benefit. So how much benefit? Well, the research has been done on 3 populations of men: men who have curvature of their penis, men who had their prostate removed for prostate cancer, and men with diabetes. And when they use it based on this protocol, they can gain 1 to 2 centimeters of length in a 3-month period. Which, Jarrett, some people might say only 1 or 2 centimeters. That's a lot of work for not that much. But a lot of my patients say, wow, 1 to 2 centimeters, I'm in.
Yeah.
I like to inform my patients of all of their options so that they can make the decision on whether or not they want to put in the effort. I've had so many patients, I started learning about this like when I was at the University of Iowa, who they weren't aware of all these technologies. And they see me, let's say 5 years after they learned that there were solutions, and they're not happy. They say, why didn't anyone tell me? I wish someone had told me. So that's like my biggest fear, is that I'm not going to share all the knowledge with someone and they're going to be upset. So my goal, it's a balance, because sometimes I overwhelm people with all the options. I want to educate them on all the options in a way where they can decide for themselves what's going to work for them now.
Yeah, you want people to know. Look, the worst thing that you can do, in my opinion, is give somebody too much information. Yeah. I mean, it's better than giving them no information. And I'd rather, I have the same mindset as you is. I'd rather you have all the information, and then if you have to call me back in 2 weeks and say, I remember 2 of them, but you told me 3 more, can you repeat them to me? I'd rather that happen than call me back in 3 weeks and say, hey, you never told me. You don't want that. So I agree with that.
And you might wonder, well, how do I bring up penile size concerns in the office that doesn't make someone uncomfortable or reduce their self-confidence? Mm-hmm. And I do it before I examine them. I do it before I examine them. And I do it as part of normal conversation. As I'm going through kind of my list, any sexual function concerns, any issues getting or maintaining erections, any testicular pain, any, pelvic pain, I say, any concerns about length or girth?
Yeah.
As if it's just a very normal question, which it is, but it's not when I'm in my exam room and doing an exam. I'm definitely not asking the question at that point, any concerns about length or girth?
Yeah.
And what a lot of people say when I ask them that question during the consult is, yeah, but I didn't think there was anything that we could do. And so as part of my educational packet, I just flip to the next page and I show them the products, and then I grab the demo off my shelf and I show them how it works. So they know it's already in my packet. They know I'm not just making it up, right? And it's just another part of the discussion about how to optimize sexual health. And in my ED packet, which I renamed, I took out the dysfunction. It no longer is titled erectile dysfunction. It's called the How to Have Great Sex Playbook. Because who doesn't want to have great sex?
That's
and that's
right.
the best packet of them all.
So in those questions, do you ever ask the guy to, like you said, it can be an uncomfortable question. Do you ever ask them, has anyone ever brought up to you, like, kind of maybe remove them from the moment and put it back on, hey, has a partner ever mentioned had an issue with length or girth, or do you just ask them directly, hey, do you have any concerns? Because they may not have any concerns, but I had 2 women say something to me. I don't know. Do you ever say it that way?
I haven't, and I don't know that I would recommend it.
Yeah.
Because if I keep it like, do you have any concerns? That would be an opportunity for them to say, well, I did have someone mention something. But I don't want to, if I bring up a partner, I don't want them to then go down a rabbit hole of like, oh,
True.
Okay, maybe there was a concern. And I don't know that it would do that, but I think I've yet to offend anyone with that question.
I don't think you would. I mean, you're just asking a question. That's not an offensive question. It may be uncomfortable for the person to answer, possibly. The issue would be, the reason why I phrase it that way is that the one thing men don't do, and I think women don't really believe this, is we don't compare ourselves to other men. So we don't walk around the locker room looking at other people's, we really don't. So other than watching, if you watch porn or something, which we know that's not real, so you don't really know, how do I measure up to the guy next to me? Am I normal or not normal? So unless a woman usually tells you it's great, it's wonderful, it's hard to know if do I have a length issue? Do I have I don't know. So that's what made me think about that is usually we're getting feedback. That's how we know there's an issue. So,
I've heard so many different things from different patients. Just earlier today, I was seeing a patient who I had put a penile implant in recently. And he's had concerns about his penile size. And he told his mom that he was concerned about his size. And his mom said, you have a normal penis. And he was thinking in his head, my mom's just saying that because I'm her son. But she kept saying like, no, I'm not saying that because you're my son. Like, you have a normal size penis. But he's like, if I'm in a locker room with 100 people, he said, I always felt like my penis was smaller than everyone else's.
So he checked. Yeah.
So he noticed it, And I've had a lot of guys say they get self-conscious about being growers and not showers.
What's that?
So like when someone who's like a grower might be shorter when they're just walking around and they're flaccid, but when they become erect, their penis really stretches and engorges. Versus a shower is someone who, let's say, has a length like this, that when they become erect, it doesn't grow very much past that. Like their flaccid length is pretty much their erect length.
Yeah.
It's interesting, even in you and I discussing this, like, I don't think you've really given that a second thought. Whereas my other guy was like, I think about this all the time. And the 100 guys in the locker room, they're all showers and I'm a grower, and that's messed up, And so we were just going down that rabbit hole today.
That's a rabbit hole. Yeah. I didn't mean to cut you off, but yeah. That's
the other thing I was just going to say is I have some guys too that tell me, well, my partner says there's no concern about my penis. My partner says that I have a big penis, but I don't believe her. So I think some guys just assume that every woman give the compliment to whatever man they're with, and they don't believe them. So they can't take the compliment.
there's a slight facts to that. We're
always all of this.
We're all over the place. Look, men are messed up. We're messed up, and we're really simple. If women could get that, we're really simple. Just pat us on the back, say it's great, mean it, look us in the eyes, mean it, and we'll be fine. We'll be fine. We'll be fine. Just don't stray from that. Stick to it. We'll be fine.
I think that the simple message or theme for both men and women is all of us want to feel comfortable in our bodies, and all of us want to feel sexy in front of our partners, and all of us want to satisfy our partners. And there are different ways of getting to all of those goals, right? But I think, yeah, we need to tell our partners how sexy they look. Even if their hair's messed up and they don't look super sexy. Like sometimes we just got to say it.
Gotta say it. You got to say it. You got to say it. No doubt about it. You have to embrace all of that. Well, look, I've taken way more time that I should have than you allotted me. But you gave a closing point there. Actually, before I close, I had a question for you. You have a twin sister that is also a doctor?
I do have a twin sister. She's a gastroenterologist.
So do you guys have any other siblings?
Hey, Jarrett.
They would have to be astrophysicists.
Hold on really quick. I don't know if I'm cutting out or if you're cutting out.
I think, to me, you were cutting out, but I think it's fine at the moment. Can you hear me?
Okay. Yeah. Do you want to ask that question again?
I was just saying if you had any other siblings. Yeah. And if so, are they like astronauts or astrophysicists? The only way they can make it to the Christmas table?
I have a brother, but he is not an astronaut or an astrophysicist.
Okay. Well, good luck,
but it's
buddy.
funny
Good
because
luck.
my sister is a gastroenterologist. When she gets items from different companies, like samples, she'll get like a box of Miralax, and I get a box of vibrators. So I think we know who's winning in this series here.
That's right. Everybody look forward to those presents from Amy at Christmas time.
Exactly.
That's awesome. Well, I appreciate your time. I definitely appreciate your insight. I appreciate everything you told us here today. And I do have a final question and I ask everybody, which is, we talked a lot about the difficulties of getting information to guys, getting them comfortable with this and getting the word out to, partners. But for you personally, when things kind of get a little tough, things get a little shaky, what do you tell yourself to maintain your game day mindset?
Oh, I tell myself there's nothing I can't handle. And I learned that from my fellowship director who trained me in my last year of training. And he said, Amy, you have the expertise. There's no one you can't help. Because sometimes you get nervous walking into a room. You're not sure if you can fix the problem or whatever. And I think that's where I like all these new novel technologies, because if I can't currently fix the problem, I know someone somewhere is going to come up with a solution. And that's why I want to know everything about everything.
Yeah. That's awesome. That's beautiful. Nothing you can't handle.
I have one final message that I want to add.
Go ahead. Yes.
You're with Game Day, and I'm in a private practice, and I'm a board certified urologist. And oftentimes when it comes to men's health clinics in the community, we talk about clinics in not a positive light. And from your perspective, I don't know what your perspective is. But I'll say at a lot of our urology conferences, a lot of the verbiage is, the person went to a random men's health clinic in the community. Mm-hmm. And it's not seen positively. Yeah. And the way that I see it is, one, there aren't enough urologists to treat men.
Yep.
Two, most urologists don't care at all about men's health and don't care at all about testosterone, right? So the reality is there aren't enough people even right now to take care of all the hormone and sexual health issues that exist. So what I would like to see is more collaboration like what you and I are doing today, which is, hey, we're all taking care of the same patient. Neither one of us can do it all alone. Right. What's your expertise? What's your access? What's my expertise? What's my access? What problems can you solve? What problems can't you solve that I might be able to solve, and vice versa? Yep. And then how are we going to treat the mutual patient? But we rarely have those discussions about what your role is and what my role is. And I'd love to see those discussions happen more often.
I completely agree. There are windows. We talked about this at the beginning. There are windows where that patient is perfect for you. And then there's a window where you're like, I can only help you so much, or I can only help you here, or I can only help you if your insurance, in a random space could cover that. But if I can't, you have a place to send them. And we've had patients that come to us and we say, hey, you need to go see your urologist first for this, and this. if they can take your insurance and you can do this with them, I would say do it, right? It's best for that. Or they just have comorbidities that have to get vetted through a urologist first. So you're absolutely right. I think there's one of the space that and you kind of led perfectly in. There's this space where we haven't connected enough with the medical community, and I don't think the medical community has yet embraced us enough. But we are, game day itself. I'm trying not to make these podcasts about game day, really about the guests, but we'll be large enough and have a big enough footprint that, and we already are, that we can come up with a strategy for us to work seamlessly together. And to your point, it's about the patient, right? It's not about you or me. There are way more than enough patients to go around. So if we could figure that out, or just keep the conversation going at the worst thing. I know you're going to meet Dr. Howell here pretty soon. Keep the conversation going. I think it'll be great for the patients.
Yeah. And then everyone wins.
Everybody wins.
Exactly. Like small businesses win, patients get the access they need. They get the expertise that they need. It's not enough to say you're going to have to wait 6 months or a year to get an appointment. And when you get the appointment, that person may or may not be interested in treating your concerns. Right. That's the problem, right? So I'm excited for, companies like the one that you're involved in, because you're putting these topics out in the open in a way that people understand and in a way that gets them pumped, where they're like, hell yeah, I'm going to see my men's health specialist today, versus, in a way that like I hope when people walk out of my clinic, they can say, yeah, Perlman's my girl, right? Yeah. Where it's like a badge of honor that if they go to like a clinic like yours or a clinic like mine, their friends know that guy's crushing it.
Yeah.
He's crushing it.
If somebody doesn't walk out of your office pumped and ready to take on the world, then they need a lobotomy or something. There's no way. I'm about to go crush it. I'm like, I am ready, girl. You got me ready for the weekend. I am hyped. What did you, Tech Ring, Restore X device? Tech
Ring, Restore X. There are so many other things too. We'll have to do another podcast on different products.
We will save that for the next podcast, 100%. So, okay. I am going to let you go. You have patients to see. I very, very much thank you. Where can people find you? Where do you want them to find you on social media or anything like that?
My Instagram is Amy Perlman, MD. And then my YouTube channel is Doc Amy Urology. And my website is primeinstitute.us.
Perfect. Thank you very much. So to everyone listening and tuning in, thank you for being a part of this fourth episode. Don't forget to subscribe, leave a review, share the episode, follow Amy on all of her social media, and send this to anyone who else is building something. This is just the beginning. And remember, every day is game day. Thank you, Amy.
Thanks, Jarrett.